I was Sangam, I'm Dr. Farah, and I am your mentor for MRCG Part 2. Today we are going to discuss a superficial study plan and what we'll be covering in your course. So basically, first let us discuss the exam format. After passing for part two, you will appear for the part one, you will appear for the part two. And it is again like the part one, a computer-based exam nowadays conducted on the PSW centers. It consists of two paper, paper one and paper two. Both are equally for 3 hours and 180 minutes. Now, each paper consists of 50 SVAs and 50 EM cubes, and it contributes to 50% of the total marks. So basically, each paper is important, each SVA is important, each MQ is important. There is a lunch break of 60 minutes in between the two. So SBS, as you know, is the single best. But the problem is in the EMPs. You need to have a thorough study. You need to follow the steps, and you have to be very focused while doing the EMPs. And once you learn how to do them, it becomes easy. Basically, there are few core modules which are there. In RCG, there are basically 18 core modules, but in part 2, 14, the most important teaching, clinical governance portion, and is less important. So basically, we have some few smaller and few lengthy modules. Lengthy modules include maternal medicine, antenatal, while the rest of them are uh, quite small to medium size. So for the lengthy modules, we have kept more practice, more discussions, and this will be covered in 4 to 5 month time period before your exam. Okay. We will be practicing or we will trying to do smaller modules per week, and because it will then help you to cover weekly a single module, which are smaller one. They will be knowing that those which are difficult one, we are going to cover in 2 or 3 weeks, and if the time allows, further. Okay. So what will be our sources of study? The most important source in the part two is basically the brain talk guideline. You have to learn them by not basically summary in this text. I would recommend not to focus on the percentages too much because the percentages which are the records are most important. So you'll often get confused what to do, what not to do, but you will be taught. Similarly, the nice guideline, they are very lengthy, but we don't have to learn them by heart. We are going to summarize and the important ones, and they are very important for EMTs. Dog articles, the latest review, basically dog articles are done once you are not finding any topic in Green Top guideline, nice guideline, then we approach dog. So if there's any discrepancy, the first one is the green top to be confirmed, and then we have the nice and then top articles and this sequence. The rest of these guidelines are helpful in sexual and contraceptions and further like stairs and consent advices as well as guideline. Very rarely we also take help from the Scottish guideline. You don't find any support there. Now, exam testers questions. It is very important. What does it mean? It are basically the course and the textbook which we are going to practice. They are very almost 10 EMQs and SBS book. Definitely, you have to be alert. You have to practice. We are going to guide you how to do that. And it's your contribution in these books to practice, practice, and practice. The daily practice of 4 to 6 hours, a dedicated time period. I know you have your family, you have your own work, but in order to pass in the first attempt, you have to be focused. Whatever we teach you, you have to revise it. And if you ask if you have any query, you can post in the Telegram for which we are going to provide you support for the 24 hours. Okay. So these are the books which are available, and we will be practicing that. So what we have planned is that we are going to cover the module weekly doing the daily practice. And definitely it's your practice, not our, because we have gone through that and we know how much we practice. We're just going to supervise you and guide you. Then the reports, definitely going the reports. Our target would be to cover the report paper weekly or 2 weekly, whatever possible. The recent one, particularly the 3 year report, we will try to cover in our practice and also will provide you the support from the previous ones. And also, once we have completed one module, we will try to do the EMQs on that module, 4 to 5 or 10, whichever possible, in a separate session and on the Telegram. This will be very helpful for you. And the most important thing that in the end, the mock examination practice, two full mock examination is included in your study plan. And try to do it before your initial examination, so they still have time for revision. And this is our short study plan. But in the end, I would say that it's your practice. You are the one who are going to do it, and we are going to just supervise. And so this is our course outline which we have planned. Thank you.